Hello, I'm Stamatia Destounis. I'm a breast radiologist at Elizabeth Wendy Breast Care. And for the next few minutes, we're going to be speaking on our abstract that we're presenting at our SNA this year on trends in breast cancer incidence in young women and our experience at our patient community breast facility. The purpose of our abstract and our work was to look at trends over time in breast cancer incidence and how was the breast cancer detected and the specific breast cancer characteristics among young women, women ages 18 to 49 over an 11-year period at one of our 7 facilities. So we went back in time and did a review over that 11-year period on our breast cancer cases diagnosed in women ages 18 to 49 between 2014 and 2024. And this group of ages comprises about 21 to 25% of what we see every year, our patient volume during the study period also, and historically. We looked at clinical and imaging information. We wanted to find out how was the breast cancer identified, what type of tumor it was, its grading, how aggressive it was, what kind of estrogen, progesterone, or HER2 receptor status there was, and also the size of the tumor and the stage of the tumor presentation. We did find some cancers during that time period that were not breast, and those were removed from our review. And also, there were some patients that were lost to follow-up that we took out. So in total, we had 1,799 breast cancers diagnosed in 1,290 women that were ages 18 to 49. In this age group, we typically find about 145 to 196 breast cancers every year. The mean age of these patients is 42.6 years. During this 11-year period, 41% of the cancers we found were on screening mammography. 59% were diagnostic. The patient came in for an evaluation. The invasive breast cancers were 80.7% of the total number of cancers. This is the type of breast cancer. It was called invasive versus the not invasive. That was 19.3%. 23 patients came in with metastatic disease. That was disease outside of the breast. The average tumor size was 2.7 centimeters for the non-invasive cancers that were called DCIS and 22 millimeters or 2.2 centimeters for invasive cancers. 21% of these young patients had a family history of breast cancer. And when we looked at the tumor grade, 19.3% were low grade, 43.9% intermediate grade, and 33%, a third of them, were high grade tumors. 8.6% were triple negative. Those are the bad cancers that ERPR, HER2 negative, and those are more difficult to treat. When we stratified the ages and performed an analysis on the ages, we found that 24% were women under 40. There's not even screening guidelines for that group of women, and 76% were women 40 to 49. Annually, when we look at cancer diagnosis for women under 40, we usually range in our facility 17 to 56. The highest number was in 2019, while for women ages 40 to 49, consistently we have greater than 98 a year breast cancers found. Under 50, when we look at that group of patients, slightly there was a change between 2014 to 2024, from 24% to 21%. But the absolute number of breast cancers found in that cohort was stable, and it's a considerable percentage of our total breast cancer volume every year. So we concluded that for women under 50, they represent consistently a substantial portion of the breast cancers that we identify at our facilities. And a significant percentage of these cancers are invasive cancers, high-grade cancers, and also triple negative. Those are aggressive and kind of bad players that we need to identify as quickly as possible, especially for the women that were under 40. These findings from our facilities support the need that we have to be vigilant in imaging protocols, and also consideration for earlier or more intensive screening for these higher risk younger population of patients.